This is about oral thrush or oral candidiasis, especially for the family. Oral thrush, also called oral candidiasis, is a condition in which the fungus Candida albicans accumulate on the lining of our mouth. Candida is a normal organism in the mouth, but sometimes it can overgrow and cause symptoms. Oral thrush causes creamy white lesions, usually on your tongue or inner cheeks. Sometimes oral thrush may spread to the roof of the mouth, gums or tonsils, or the back of the throat. Although oral thrush can affect anyone, it's more likely to occur in the babies and older adults because they have reduced immunity. It can also occur in people with compromised immune system, certain health conditions, or people who take certain medications such as corticosteroids. The main symptoms include creamy white lesion on your tongue, inner cheeks, and sometimes on the roof of your mouth and gums and tonsils, slightly raised lesions with cottage cheese-like appearance, redness, burning, or soreness that may be severe enough to cause difficult eating or swallowing. Slight bleeding if the lesions are rubbed or scraped is seen, unlike that of milk. Cracking and redness at the corners of your mouth and the loss of taste. In severe cases, usually related to weakened immune system, due to any reason, the lesion may spread downward into the esophagus, esophageal candidiasis. In this case, difficult swallowing and pain or feel as if food is getting stuck in the throat is felt. In breastfeeding babies, infants may have trouble feeding or be fussy and irritable. They can pass the infection to their mother's breast during breastfeeding. The infection may then pass back and forth between mother's breast and the baby's mouth. Overall, risk factors for having oral candidiasis include weakened immunity. Oral thrush is more likely to occur in infants and older adults due to reduced immunity in this age group. And some medical conditions and treatments can suppress our immune system, such as malignancy, cancers, and treatments for cancers, diabetes, and HIV/AIDS. Use of drugs that suppress immunity, such as corticosteroids, and vaginal yeast infection is a risk factor also. Vaginal yeast infections are caused by the same fungus, Candida, that causes oral thrush. You can pass the infection to your baby. The other is antibiotics. Antibiotics that disturb the normal balance of microorganisms in your body can increase your risk of oral thrush. Other oral conditions, such as wearing dentures and having conditions that cause dry mouth, can increase the risk of oral thrush. The next is about treatment. The goal of any oral thrush treatment is to stop the rapid spread of the fungus. But the best approach may depend on age and overall health and also the cause of the infection. In healthy adults and the children, the best first-line management is antifungal medication. This comes in several forms, including lozenges, tablets, or liquids that swish in the mouth and then to be swallowed. If these topical medications are not effective, medication may be given that works throughout the body. In infants and the nursing mothers, if the mother is breastfeeding and an infant has oral thrush, the mother and their baby could pass the infection back and forth. So, antifungal medications, especially topical one, is prescribed for both baby's mouth and the antifungal cream for mother's breast. The next issue is about prevention. Those measures may help reduce your risk of developing candida infections. Those include rinse your mouth. If you need to use a corticosteroid inhaler, be sure to rinse your mouth with water or brush your teeth after taking your medication. Brush your teeth at least twice a day and floss daily or as often as your dentist recommends. Check your dentures. Remove your dentures at night. Make sure dentures fit properly and they don't cause irritation. Clean your dentures daily. See your dentist regularly, especially if you have diabetes or weird dentures. Ask your dentist how often you need to be seen. Watch what you eat. Try limiting the amount of sugar containing foods you eat. Those may encourage the growth of candida. Maintain good blood sugar control if you have diabetes. Well-controlled blood sugar can reduce the amount of sugar in your saliva, discouraging the growth of candida. Treat a vaginal yeast infection as soon as possible and treat dry mouth. Ask your physician about ways to avoid or treat your dry mouth. Thank you.